Well, the Colorado Coalition for the Homeless provides a variety of housing and health services to homeless families and individuals. Many men, women, and children who never thought that they would be homeless are now turning to us for help.
We would try to give the basic care, get their immunizations up to date, check on them for any kind of communicable disease that we were talking about, making sure the moms are staying healthy. I worry about the patients that I have seen over these many years on the van, and I'm not sure what they're going to do.
The mobile clinic costs about $250,000 a year to operate, and so as we have gone through budget cuts, we had to mothball the clinic. We had to close it down for the time being.
This is a service that absolutely saves lives. My life was saved, and I'm just thinking, as we've had to close this program down, how many lives are being lost.
The very first person the van saw when they first started coming to the gathering place was a woman named Laura, and Laura was aware of the fact that she had a lump in her breast.
So I always came to the gathering place, and when the van was here, I thought I needed something that was handy. She looked at it more closer, and then she went and she told me, "You need to get to the Denver Health Clinic right now." If I hadn't went right then, I wouldn't have lived 3 months. That van is very important. It's helped babies, it's helped children, it's helped elderly, it's helped pregnant women.
I was in the motel. I was sick and I couldn't get out of bed. I didn't know what was wrong with me. My chest was killing me. I thought I was having a heart attack. They took me in right away because they could see that I was just gray. I could barely breathe. I couldn't get out of bed. I was that weak. I could not get out of bed and get on the bus because I don't have a car. If the van hadn't come, I probably would have laid there and died.
The Stout Street van is needed. It's something that is needed. I've utilized it numerous times, and a lot of times people will put off going to a hospital, number one, because they don't have insurance, and some of them won't even take you.
But if half of those people went to the emergency room instead of going to the van, the cost to the community would be about $1.4 million per year. So the cost savings of what you would be giving to the community would be enormous.
If the van don't come around anymore, a lot of people would probably die.
I wish I could write a check. If I had $250,000 to give, I would give it right now if it was my last dime. Because if it wasn't for this program, I wouldn't be alive. And I would give anything to save even just one life. It's so important.